Hello, this is Mickey at Pure Health. Thanks for downloading and viewing this video. I really hope it helps for you. Today we're just going to go through some SIBO test results together, which hopefully will help you to understand the reports a bit more. Okay, so here we can see an Aerodiagnostics Lactulose SIBO result. So we'll just go through the sort of charts and the graph and stuff just so we get the lay of the land. So you can see up here, this is where we're looking at the hydrogen levels, and we can see that the expected level is lower than 20 parts per million, as we've said. And then we're looking at methane, which is lower than 12, but also note that lower than 3 mark there. So some experts are thinking that anything between 3 and 9 is positive for methane particularly. So that's quite interesting, and some people actually, I think Genova's bringing out a test, I think in the US at the moment, that are giving that as 10, so there's a bit of a debate. So I reckon somewhere between 3 and 12, depending on what the symptoms are like within your particular body, that could be positive. So 7 here is in normal on the report, but maybe that might be quite high for that particular person, but they're positive on hydrogen anyway. And then we're looking at the combined levels here, which should be less than 15 parts per million, and we're at 43. So clearly, and then the chart tells you down here, the lab tells you down here, that that suggests some small intestinal bacterial overgrowth, so that's a positive result. And over here you've sort of got the data that they've crunched to get to this bit here. So, and I like this report because it gives you this what should happen within the timing for the small intestine. Then there's a sort of transition period where the bacteria will be going between the small intestine and the large intestine, and that could vary obviously depending on the transit time, whether you're slow or whether you're fast. So if you were you have a fast transit time, then basically you might have SIBO that shows, you know, somewhere about 60 minutes or something like that. And we'll look at this because I think this is one down here. But if you were a slow transit time person, you might not get a positive until about 120 to 140. And if a person looking at that and just takes this at face value, and that person has a rise at 140 minutes and that's it, say, they might think that that's actually a negative result, and you haven't got SIBO, you've got a rise of gases in the large intestine, which would be expected. But if that person was constipated and they actually had a little methane bump here, which you have, then I would be tempted to say that that was positive for SIBO. But obviously it very much depends on the analysis of what that person's case is like, what your symptoms are like. So I hope that makes a bit of sense. But I quite like that you see the small intestine, the transition, and the large intestine, and they've repeated it down here as well, which we'll look at in a minute. So here we've got the hydrogen numbers, and we're looking for anything over 20 over the baseline. So the baseline here was 0, and we can quite clearly see that from about 100 minutes on, here we've got 32 looks, so we're way over 20 there. So and we're looking at the methane here, and again we're looking at anything over 12 according to this particular lab, which isn't high at all there, so that's fine, which is why you've got a normal result here. And then we're looking at combined, and this lab works the combined out slightly differently to some of the others, but basically that can make quite a difference, I'm told. This is interesting here, where you're looking at the carbon dioxide levels. This is really here to check that the sample is viable. So they're looking to see, are you actually testing lung or alveolar air as opposed to the air that was in the room at the time you did the test, and that's a sort of double check there. So if that doesn't look right, then they'll tell you that it's not a viable sample. Okay, so next let's have a look at the actual graph here. I work well with graphs, actually, to be honest. You can look at all the numbers and you've got that. I mean, to be honest, if you want to know whether you've got a positive result or not, this is the bit you look at, because it will tell you. So that's all you would need to look at. But sometimes if it's not quite so, you know, straightforward, the graph can actually give you an idea of what's going on. So on this one, you can see what's called, this is a lactulose test, and we know that lactulose isn't absorbed through any of the small or the large intestine, so you expect what you call a double peak, although that doesn't always happen. And people think, oh, I haven't got a double peak, and so therefore it's not a correct test, but that's actually not right. It's quite common not to have a double peak in actual fact, but we've got one here. What I mean by that is it's gone up during the sort of the 90 to 100 minutes of the small intestine. Look, we're up here with the hydrogen has gone up. So the red line is the combination between hydrogen and methane. So you can see that's quite high. So I'd be tempted in this particular case to treat methane and hydrogen, even though methane isn't particularly high. I'd sort of think, hang on a minute, I think there's probably a little bit going on there. But hydrogen is the main issue, and that's the blue line, and that's gone up. And remember that most people are hydrogen predominant in terms of the gases. So you're going to find that blue line highest in most SIBO positive cases, but you will find methane higher when somebody's, for example, got constipation. You tend to get much more methane in that group, but also 30% of the general population are methane predominant producers. And remember that a lot of the labs, especially mainstream labs, don't actually either have a methane machine, so the machine that they use doesn't calculate the methane, it only looks at the hydrogen, or they do have a machine that does it but they don't report on it, so they'd be missing an awful lot of people if you did that. So it's important that whatever test you use is going to test for hydrogen and methane. Okay, so I hope that makes sense. So with this particular person, you've got the SIBO going, you've got the gases going up within the first 90 minutes. So we know that that's in the small intestine area. So you can see the small intestine band here, and in the transition area. Okay, so that person has definitely got an increase of gases, and so you would say that that was positive for SIBO. And then we've got the transition period that goes down, nothing much is happening. So you can see the transition period for this person is about spot on, actually, between 120 to 140 minutes. And then we start going back up again, which is in the large intestine, in the colon, when the natural fermentation of those bacteria will happen anyway. So that's what's the classical double peak. I hope that all makes sense. And you've basically got down here a repeat of the information that you've got there in a sort of easy way to see it. Okay, so that is a double peak lactulose result, which is positive for SIBO, and we know that it's viable because the carbon dioxide is fine. Okay, I hope that makes sense. Okay, this is a different lactulose result for you just to look at to see, and what we're looking at here really is that we haven't got the classic double peak here, so it's a very positive result. You can see from the results up here we've got a way increase in hydrogen there. The methane is also high, over 12, definitely over the 3, and obviously look at the combination, look, 173, so bacterial overgrowth is suspected, I'd say so on that one. And we know that it's viable again because we're looking at the carbon dioxide figures, and that all looks okay. So looking at the actual graph itself, again it's the hydrogen that's predominant on this one. It's definitely going up quite high over the baseline. The baseline was quite high to start with, which is quite normal. You do see that with hydrogen, so that was 10, and by the time we've got to 60 minutes, look, it's gone up to 61 already. So that's actually a really positive result, and that person's got quite a SIBO problem going on there. But the reason why I just chose this to look at is because you haven't got the classic double peak going on there. Doesn't mean to say there's any problem in the colon or anything like that. It's just that it's not showing on that particular test result. Okay, so that should give you an idea of a different positive result. Okay, here's our next one. This is a glucose test result. Just to give you an idea of the difference between them. It's pretty much the same sort of thing. You can see that we've got the same charts and the same numbers and the graph to look at. The thing to remember, as we know with glucose, is that the parameters are different, and also we know that glucose is absorbed within the small intestine within about the first 90 to 100 minutes. So you're not going to get a double peak, not that you do all the time anyway, but you're definitely not going to get one with the large intestine on a glucose result, because it just isn't there. It's already been absorbed by the time we've got to here, really. Okay, so let's look over here first of all. So we've got the hydrogen. Parameters are a little bit different. So we've got less than 12 for hydrogen, and we've also got the less than 12 and the less than 3, really. In certain cases, especially people with constipation, for the methane, which is virtually the same, and the increase is slightly different, and that's less than 12 again. And again, you've still got the little bit here that shows you whether it's a positive result or not. We've got all the same numbers here, and the carbon dioxide, I keep wanting to say carbon monoxide, don't I? Carbon dioxide levels here to check that everything is alveolar lung air and not the room air that you breathed into the samples. Okay, so the main thing to have a look at here is the fact that we've got, again, it's the hydrogen that's going up there, but the methane is quite high on this one as well, but it's not out of the normal levels. But again, it depends if this person's got constipation. So we've definitely gone up. If you look sort of to the 90 to 100 minute area here, we can definitely see that the glucose has started to go up within that point, so we can say it's a positive SIBO result there. And there's a sharp drop that comes on here, which is where we can pretty much guarantee that the glucose has been fully absorbed, so the bacteria aren't fermenting it anymore, and so therefore the graph will drop off. Okay, so that's the difference with a glucose test result. Both are viable. If you've got a normal transit time, if you had more of a constipation sort of problem, then I would go for a lactulose, just in case you get what's called a distal end SIBO problem. In other words, it's towards the end of the small intestine and not sort of the beginning or the middle, which you might find. Otherwise, you might miss it on a glucose test. Having said that, some of the experts that I was listening to, like Dr. Ruscio and Dr. Seebecker, were saying that in practice, they're not really seeing any difference. They don't, even though it should make a difference that the glucose is absorbed in the small intestine, it's not actually showing a difference in the results that they're seeing. So that's interesting. Anyway, so I hope that helps, and should give you an idea about the difference in the glucose test. So I tend to go for lactulose, but glucose will do it if you've got a normal regular transit time, which we've talked about in the blog post, so refer back to that. Okay, so the last thing to mention, I haven't got a picture of it, I'll have to see if I can find one, but is what we call the flat line result. So sometimes you're going to get all three lines are going to be really pretty much close to the bottom here, so there's not much going on, and you might think that that's just a negative result, and it could well be. The only thing to look at there is if it comes back completely flat, you think, okay, did I get enough actual air in the sample? So the first thing you do is you look at the carbon dioxide levels. If that looks okay, you can pretty much guarantee it's a viable result, and it would be negative. If it didn't look okay, then you would repeat the sample. But to be honest, I think the lab would tell you anyway if it wasn't a viable sample and not report on it. So if it's a flatliner, you can pretty much gather that it will be a viable result. So it's either negative, or it could be that you've tested too soon after some treatment. There's nothing much going on fermenty wise. So check that. I mean, they do say now that there's some confusion, that some people say that you have to wait the 4 weeks again after treatment to test. But some of the doctors I listened to and have read their stuff say that actually after 2 days is fine. I sort of tend to err on the side of caution and say about sort of 4 to 5 days as a retest time is okay. But say you did that and it was completely flat and you felt like you were still having SIBO symptoms, you would probably need to retest a bit later to double check whether it is still SIBO or it isn't. And it could be something completely different. I have come across that before, where people think that actually they've still got the same symptoms or some of the same symptoms, but in fact actually when we've double checked the SIBO test, it's still low. and a negative result, but actually they're getting symptoms from some other reason, and the other reason might have been going on at the same time as the SIBO, so just bear that one in mind. And then lastly, the first question I would ask once I know all that, and that person still thinks that they're SIBO positive, but it's a flatline result, is what does their poo smell like? So if their stools are smelling really rotten, like eggs or sort of rotting food type thing, you know, you're not going to miss that, are you? Then it can be that actually what you're producing is hydrogen sulfide, and you'll get a flatline result on the methane and hydrogen, because the hydrogen sulfide is going to nick all of the methane and hydrogen molecules, so there will be nothing left to see on the actual test. So that's a different positive. So it doesn't happen very often, but if your poo's a bit smelly in that kind of way and you're having symptoms, then it might be that actually you've got a hydrogen sulfide gas fermenting problem rather than just the standard methane and hydrogen, which does happen. And you can test for hydrogen sulfide. I haven't got one yet, but I think that we should be able to find one. It doesn't happen very often, I've not been asked for it, but if you needed to, that may well be something to test for, to confirm, or you just assume it and you treat anyway. Okay, so that is all 4 of the sort of type of test results I wanted to talk about. I hope you found that helpful. I've not done these kinds of screencast things before, so I hope I didn't and ah too much for you and it all made a bit of sense, and perhaps I'll have to go back and do some editing. Okay, so hope that was helpful, and don't forget to read the blog post, and I'll speak to you soon.